Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over the job overview of a managed care nurse. In this video I want to cover who they are, where they work, their job duties, educational requirements to become one, salary information, and the pros and cons of this nursing specialty. So first let's talk about who these nurses are. These are registered nurses who specialize in managing care of patients who receive government funding health care. And this is usually low income, really young, or the elderly people who are on Medicare and Medicaid. These nurses ensure that patients receive proper care by focusing on preventative care and preventing unnecessary medical care, which in turn reduces healthcare costs for the patient and for the hospitals and insurance companies. So they really help to keep healthcare costs down. And they work as a liaison between the patient, the medical doctor, the hospital, and insurance company. So they help correlate the patient's care through all those different avenues. Now, where do these nurses work? They typically work in a hospital, for medical insurance companies, community health clinics, regular clinics, or social service programs. Okay, what are their job duties? What do they do? They complete lots of paperwork. That is one of the big things they do is paperwork. They act as a liaison and a patient advocate, which comes back to what we talked about earlier. They help keep the healthcare costs low for the patient. They educate the patient about preventative care, which are vaccinations, well visits, screenings, because we want to catch things early. And this helps prevent all of a sudden something terrible happening to the patient, which could have been avoided if they had a screening, and if we caught it early, it wouldn't have been so expensive. So that really helps. And they examine patient records. Okay, educational requirements. How do you become one? Okay, typically these positions like to hire nurses who already have clinical experience of at least 3 to 5 years. This is because the nurse has worked in the healthcare setting. They know how the healthcare system works, so they have that background already. And they get hired for that job. It's optional, but highly encouraged that you get certified. Some employers want their managed care nurses to be certified as a certified managed care nurse. Some, they will hire you and then you get the credentialing. Some do not care. So it totally depends on what your employer wants. But in order to do that, you become credentialed through the American Association of Managed Care Nurses. What you do is you take an exam, but in order to sit for the exam, you must have at least 3 to 5 years of clinical experience, and you have to complete a home study program. You may not have to complete a home study program if you've already worked as a managed care nurse or you have equivalent experience. You could skip that and just take the exam. So you have to pass the exam and then you'll be a certified managed care nurse. Okay, so how much do these nurses make? Typically, according to Indeed.com, they make about $67,000 a year. And this depends greatly on where you live, your years of experience, where are you working? Are you working in a hospital or an insurance company? And they took all those figures, put them together, divided it out, and that was the average. So it depends on where you live. Okay, pros and cons. Like with any job, there are the pros and the cons. There's no perfect job out there, right? Okay, so pros. One pro is they like helping the patients get the care they need, but not the cost. So they keep the cost down for the patient and educate them about the preventative care. They get satisfaction from that. It tends to be less chaotic than bedside nursing, a little bit more laid back. They love working with other disciplines. They're working with the medical doctors, the insurance companies, things like that. And they love how they have that extra knowledge of how the healthcare system works. This is really good if you have a loved one who's going to be going into the hospital. Maybe they need some of these government-funded programs. You already have that inside knowledge of how everything works. So that is a perk of this job. Okay, cons. Some report that they miss the bedside nursing, the patient interaction on that type of level, and using their clinical nursing skills like starting IVs, inserting Foleys, things like that, because they don't do that as a managed care nurse. It is frustrating dealing with insurance companies because every insurance company is different. They'll reimburse for this or maybe not that. So having to deal with that can be really frustrating. And of course, last but not least, all the paperwork that they have to do. It's a lot of documentation. So that is a little bit about a managed care nurse. Please check out my other nursing specialty videos, and thank you so much for watching, and please consider subscribing to this YouTube channel.